Hey guys, Dr. Cameron John Gear with San Diego Chiropractic Neurology, and today we're going to be talking about low back pain. Low back pain actually is something that 8 out of 10 people will experience at some point in their life. What's even crazier is that it's actually the #1 cause of disability in the US. And when most people think about back pain, the first thought that comes to mind is something like a muscle tweak or poor posture. Maybe they did something wrong at the gym, or they woke up with it from sleeping wrong. This might be true in some cases, but something that's less known and is just as common is it being caused by a disc injury. Discs actually sit between the bones in our spine. They are kind of like a jelly donut. So the outer shell's like the crust, the inner liquid parts like the jelly. Now, discs, like most tissues, will wear down and become dehydrated over time. Now that wearing down means the outer fibers begin to tear. And the problem with that is that jelly center is going to start pushing in some of those weak points where things have worn down most. And it's going to eventually start to push right through. This is what we call a herniation. A herniation is typically the beginning, early stage of most disc injuries. Now as time progresses, you can imagine that that injured disc is going to get more worn down and that tear is going to begin to go wider and wider. That means that more of the jelly is going to bulge out. So for the later stages, what we call that disc injury is now a disc bulge. Now, because of the way our bodies are designed and what types of activities we expose our bodies to, a large majority of disc injuries happen in the neck and in the lower back, or what we like to call the cervical spine and the lumbar spine. When we get symptoms in those regions, we can end up with obvious things like pain, muscle tension, but we can also end up with weird abnormal nerve sensations like sciatica, shooting pains, numbness and tingling, burning, cooling, and if it gets bad enough, we can actually end up with full-on weakness. Maybe our grip strength is going down, or our legs feel funny and maybe our balance is off. Now, why is this so important to deal with as soon as possible? It's because we only have a certain window of time to disrupt this process and prevent things from spiraling and getting worse. The disc is going to continue to bulge. It's also going to continue to flatten. Once it's gone too far, you'll likely end up in a surgeon's office. The problem is it doesn't just stop with the surgeon's office. Most likely, you're going to have to start limiting certain activities or maybe completely giving up some of those. This might be things like some of your hobbies like golfing, hiking, exercising, or maybe it's chores that you're doing around the house that are really small. It could even get so severe that you might actually have to pivot what type of career you're doing. Now, of course, we can mask these symptoms with painkillers or anti-inflammatories, but do you think that's going to stop the process from progressing? Probably not. This is why it's so important that we interject at that opportune window of time, that window before you end up in a surgeon's office. And the good news is we do have conservative treatment options that exist. So things do not need to snowball to this point. Now, if you or someone you know is curious about what some of these good options might be, give us a call or shoot us a message, and we can get you coordinated with one of our doctors for a consultation. And they can see if you're a good fit for one of these options. Thanks for listening, and we'll catch you in the next video.